NHS is a complex and unpredictable environment, often subject to constant interruptions and the need for multitasking. Throughout a normal working day, staff communicate with each other in numerous ways, for example telephone, handovers and ward rounds. The majority of adverse events involve some level of communication failure. Daily safety briefings and the use of SBAR have been tested and implemented to promote a culture of safety for all staff. Briefings make safety part of the daily routine. They give staff a voice to raise issues and concerns, including equipment failures, infections, medications, and patient risks. One of the high-level aims for the programme is a 15% reduction in acute hospital mortality. We believe that all of the interventions collectively will achieve this ambitious aim. Critical to this success is the recognition and early rescue of the deteriorating patients. A system of early warning scoring, giving vital signs a score, is now being used in every ward. This score enables staff to recognise any deterioration in a patient's condition and intervene early to prevent cardiac arrest. Early evidence is showing that this is having an impact on reducing crash calls. In general, people are engaged because frontline staff lead the work, develop their own tools, then test and implement until the processes are 95% reliable. The evidence base is the same, but the way changes happen can be very different. When it came to ventilator care bundles, for example, the first time practice was measured, no patient was found to have received optimum care. 6 weeks later, 100% of patients received the right care at the right time and continue to do so.
And what the introduction of bundles gave us was the ability to consistently apply proven therapies to try and improve outcome in an intensive care unit. The first one we did was the ventilator-associated pneumonia bundle, which has 5 distinct elements to it: DVT prophylaxis, gastric prophylaxis, raised head of the bed, sedation vacation or assessment for sedation vacation every day, and the assessment for weaning every day. In fact, we're 329 since our last MRSA bacteremia. Beauty of the bundles is it involves everybody. It's not just medical staff, it's also nursing staff, and it's everybody's business to ask, have we done this part of the bundle on the ward round and in the evenings of every shift. So overall, I think the bundles have been successful in that they've helped certainly with central line infection rates, and that's less than we can remember. Before we'd started this work, we didn't know what our pneumonia rate really was, and that has come down since we started 3.5, 4 years ago. So overall, a good success.
Sustainable improvement with regards to patient care, I think it's absolutely imperative that we look at it from a managerial point of view, from a top-down and bottom-up approach. I think we've got to really look at the senior management within the organisation as being a vital aspect in taking forward safer patient care. The safer patient walk rounds, we, the senior people in the organisation, engage with the frontline staff, and working collectively we find that we're able to make changes and develop action plans that take us forward. I think over the course of the last 2 years we've undertaken probably the best part of 200 safer patient walk rounds. That if we're not actually improving things, we're harming patients. And for all of us, I think that's unacceptable.
NHS Tayside's patient safety work is driving up standards of care, cleanliness and treatment, and this is translating into real benefit for patients.
The amount of times the nurses and other members of staff are washing their hands, it just must be a thing that they must sleep with. They must get up and think hygiene. They must go to bed and think hygiene, because hygiene is so important. When you've had an illness, you have to be sure you could relax and know that the nursing staff are taking care of their hygiene, which makes you or me healthier. Each bed also has some cream to it. So you see, even if they're going to make a bed and then go on to make another, they just squeeze the cream at the end of your bed. And when they're doing anything, that, you know, it's not just making beds or that. You see them really washing their hands. And to be quite honest, I wouldn't hesitate to ask someone if they've washed their hands, you know, but they haven't. And I brought all special hygiene cream in and everything, and I'm so glad I haven't had to use it, not even once.
Our aim is to transform the organisation through leadership in safety and quality, involving everyone to make care safer for every patient, every time.